So today's webinar will focus on communication during a crisis, and we'll look specifically at both public-facing and interagency communication, specifically addressing any psychosocial impacts, approaches, challenges, methods, and different tools available. As a result, the agenda today will be split into three separate categories. The first one will be recommendations and analysis on communication challenges and approaches. We'll have 3 presentations during that time. The second section will be recommendations for mitigation and management of communication. And the final section will be on recommendations on the tools available for supporting communication. Without further ado, I will now pass it over to Luca, who is the No Fear coordinator. Over to you, Luca.
Hello, Natasha, and good afternoon to everyone. On the behalf of the No Fear Consortium, I would like to thank you, the Proactive Project, for having proposed to co-organize this webinar. Next. No Fear project has been funded in 2018 and brings together a pan-European and beyond network of emergency medical practitioners, suppliers, decision makers, and policymakers, with the goal to achieve a common understanding of needs and priorities, to fill operational gaps, and to pinpoint areas for future research. In order to face these challenges, next, we bring together a strong network of partners. You see in the slide before. And No Fear, here are our fantastic partnership. Next. The No Fear project is built on 3 main pillars: acute care of patient, acute care operation security related incidents, and training and personnel and volunteers. The activities undertaken in the pillars are supported by 2 networks, the practitioner, decision and policy makers, and the suppliers and academia. We complete our work plan with 2 crossing-cutting activities, with the analysis of the ethical, human, social, and legal perspective, and the innovation, standardization, and uptake activities. Next. For each pillar, the No Fear partners identify lessons learned, best practices, current needs and new threats and trends, identified current and innovative solutions, host workshops, exercises, and demonstration, and provide solution to our stakeholder. Next. When the pandemic spread, the expectation changed from society and medical care practitioners, and we learned that pandemic responses require the coordination and cooperation among practitioners, suppliers, researchers, and policymakers. Pandemic's response encompasses the 3 pillars of our project and has significant human, social, and legal impact. We also understand that timely exchange of lessons learned and good practice is fundamental, and research, innovation, and operation are extremely dependent one from the other. Next. How does the project reply to the demand coming from our network for up-to-date information and solution? In March 2020, No Fear launches its webinar series focused on COVID-19, aiming at involving its strong existing global network of practitioners involved firsthand in the COVID-19 response, creating opportunities for quick and dirty exchanges of information, practices, lessons learned, exploring how different countries respond to the same challenges in different stages of the pandemics, investigating the availability of newly developed tools or services for the COVID-19 response. Thank you, Natasha. I don't want for sure to read all these titles, but just some of them, like for example, hospital organizations, ventilation techniques, use of convalescent plasma, just-in-time training, and so on. and you see also the upcoming webinars, that is 2-day webinars, that is dedicated to the communication in crisis. It was very important to underline and to say that all these topics were a very burning questions when we delivered these webinars. Next. And about the topic of the present webinar about communication, I would like also to underline and to give you this important news that you can find all our lesson learned in a list of comprehensive reports on lesson learned, best practices, needs and gaps that are publicly available online on our website. And for my side is everything. I would like to give the floor to the other important speakers, and thank you very much.
Thank you very much for that, Luca. I'll hand straight over to Grigore, please, for the proactive overview.
Thank you very much, Natasha and Luca. Good afternoon, everyone. My name is Grigore Havernano, and I work at UIC in Paris. UIC is the Worldwide Railway Organization, which is also coordinating Project Proactive. So I would also like to thank No Fear for this wonderful cooperation. And I will now give you a very brief overview of Proactive. Next slide, please. So Proactive is a research and innovation action funded by the European Commission as a Horizon 2020 project. It started in 2019 for an initial period of 36 months, and this is now likely to be extended because of the COVID-19 pandemic. As you can see from our project title and also the fight against crime and terrorism topic under which we are funded, we are dealing with chemical, biological, radiological, nuclear, and explosive threats, in short, Cbrne. And we're doing it, we deal with this topic from a slightly different angle compared to other past and ongoing projects working in the same area. While other projects are very technically focused, Proactive has a very strong focus on the human factor, and we're using social science methods to study these things. And as you can see depicted on this slide, the main project objectives can be reduced to two main goals. The first one is to help various categories of practitioners harmonize their procedures between them, between LEAs, law enforcement agencies, firefighters, medical responders, civil protection, and also the military. And on the other side, we want to help all these practitioners better articulate their tools and procedures to the needs of the general public, and in particular to the needs of vulnerable groups. And we have in Proactive a quite large definition of vulnerability. Next, please. In this slide, you can see some key facts about Proactive. We bring together 15 partners from 9 European member states and 3 associated countries. Beyond the consortium, we managed to build already quite a strong social engagement with practitioners and with the civil society through our active and engaged advisory boards that we like to call PSAB and CSAB, and you may hear about these acronyms later on. We also build synergies with quite a lot of projects, and I also think that today's event is a nice illustration of that. And we engage with end users through a very mixed methods from social science research, such as workshops, online surveys, interviews, and focus groups. And if we go to the next slide, I would like to take the opportunity to invite you to contribute to one of our ongoing studies, an online survey, which will be public. The results will be public and will be ready in August this year. And you can be among the first ones to benefit from the results. So please contribute and also help us by sharing it with your colleagues and network. Next, please. In Proactive, we're not doing just desk research. We also intend to test and evaluate some of our recommendations and also the tools we're building on the field with practitioners. We're developing 3 toolkits, one for the civil society, one for the law enforcement agencies, and one for policymakers. And we want, of course, to make sure that these are tested before the project ends. Next, please. So the three exercises we're planning are multidisciplinary, meaning that they will involve a variety of stakeholders. They will be hold each exercise in a different country jointly with Project eNotice. I'm quite sure that many of you are familiar with eNotice as well. And each exercise will be followed by an evaluation workshop under which we will also conduct a hot debrief, and we will be able to learn a lot of things immediately after each exercise. And most importantly, each field exercise will include members of the civil society. This has been rarely done before. We will also bring as proactive representatives of vulnerable groups and evaluate the interaction between these people and the first responders. Next, please. This is just to invite you to have a look at our website. The good news is that in Proactive, despite the sensitive topic we're dealing with, many of our deliverables are public. So from the 31, I believe, deliverables that have been already submitted to the European Commission, 20 of them are available for download on our website. And many of you are practitioners. As practitioners, you may want to check out especially the results of work package 2, but there are also other interesting deliverables that you may want to have a look at. And with this, I would like to end my presentation, and thank you very much for your attention. And again, on behalf of the whole Proactive team, we wish you a very fruitful workshop.
Thank you very much, Grigore, and thank you, Luca. If you would like to know any more about both of those projects, then please do feel free to contact either Luca or Grigore directly. Also, you're welcome to come through myself as well. I have had to turn my video off temporarily because my internet connection's unstable. The joys of online workshops. Hopefully it will be back on shortly. So we'll move on then to the first section of the webinar, which is on the recommendations and analysis on communication approaches and challenges in responding to a crisis event, including Cbrne terrorism. I will hand the floor now to Hein, who's already prepared with his video on to do the first presentation.
Thank you very much. Thank you, Natasha, for the invitation. And I hope there will be no sirens while I'm speaking, so I will be able to finish my presentation. If I may have the next slide, please. My name is Chaim Rafalowski. I'm the Disaster Management Coordinator of Magen David Adom in Israel. Magen David Adom is the national ambulance provider, the EMS, for the whole state of Israel and the Red Cross Society in Israel. And I will focus on our work during the COVID pandemic. And what you are seeing now is the first months of the activities for Magen David Adom during the COVID outbreak. And we started sampling people in different settings, at home, in nursing homes, in drive-through, and in large sampling sites. Next slide, please. We also, since December, started vaccinating people. Magen David Adom vaccinated more than 500,000 people. Nursing homes and again large sites for vaccination. A major campaign. Of course, we treated and transported to the hospitals.
Happening right now?
Natasha, can you hear me?
Yes, I can. Sorry, Laura.
Okay. No, sorry, because I had some background.
No problem.
Laura.
It's okay. It's okay. Carry on, Hein.
We treated and transported people suspected or confirmed as COVID cases. We collected plasma, what is called the convalescent plasma from recuperating patients. And I would like to draw your attention to the fact that Magen David Adom in Israel operates the emergency number. We don't have a 112 system in Israel. So Magen David Adom operates its own emergency operation centers. And if we daily deal with 37,000 calls, we actually during 3 months did what we would do on an annual basis. From 37,000 calls a day, we ended doing almost 87,000 calls in one day on March 31st. This is just to give you an idea about the overwhelming number of calls. And I would start by saying, despite the fact that there were wonderful websites in many languages, in very clear and plain language of the Ministry of Health, giving people very clear guidance on what they should do. Still, people would call. So my next slide, please. And here I would go directly to our lessons observed. I would not dare saying lessons learned. I think it's a little bit premature to say lessons learned. First, it's about language. We are all talking about communications, and in many cases we confuse two terms. One is the technical aspect, the technology aspect of communication, on the technology we use, and sometimes we are talking about the process of delivering messages or interaction with others. And I think that many of the discussions I've heard, especially around the pandemic, are very confused about communications technology or communications process. One of the things that we saw is that worried people want to talk to a human being. They saw the guidelines on the website, and it was amazing because in many cases I could tell that they are in front of their computer and they are literally reading to us what is written on the screen, and what they wanted to hear is a human being on the other side saying, yes, it's true, this is what you should do. We are a country which prides itself for being a very high literacy in computers. Everyone uses a computer. 4 years old use tablets, and still people, when they want to be reassured, they want human beings to talk to them. And I leave to my dear friend and colleague, Dr. Barbara Yuen, to talk about the psychology behind that. But we tried boots, we tried automatic answers, and they all failed. People wanted to talk to a human being. So it's an interesting phenomena with, of course, critical implications on the emergency services where people were calling. And that's another question. Why are they calling the emergency services and not their primary healthcare physician when it comes to a public health emergency? That's another question. The other thing is that as a crisis manager, and as my colleagues would say, for the last 500 years I'm in the business, almost, we were trained to deliver a message. My training in communications is how do I stand in a press conference in front of a camera in an interview and I deliver a message. And today people don't want us to deliver a message. They want a dialogue. And the problem is that we are not ready in the system manner to have dialogue with people. People want to have a chat with us. Maybe not face-to-face, through Facebook or other means, but they want to ask questions and they want us to answer them. And to be very honest, we are not ready to talk virtually with 1 million people or with 100,000 people. So how do we do that? How do we give people this feeling that there is a human being on the other side dealing with their concerns, respecting their concerns and giving time and energy thinking of their concerns? I think that this is one of our greatest challenges, and that goes directly to the fact that what we realized is that when we are saying something on mass media, like TV, immediately in Facebook groups, there are tons of comments about whatever has been said on the media. And we understand that today, the peers on the Facebook group or any other group, WhatsApp or whatever, have more power than the expert on TV. So you can say the most intelligent thing, but if the Facebook group says it's nonsense, it will be treated as nonsense. One of the things we saw is, and that's a challenge, and that's a great challenge. The image of the gentleman on the slide is a very interesting image because this gentleman is a physician, an MD, who used to be many years ago the Director General of our Ministry of Health. And during the first weeks of the pandemic, he had an agenda with a slogan, "It is nothing more than a flu." And more people die from flu every year than people dying from COVID. I'm sure you all heard those statements, but when they come from an expert in medicine, who used to be the Director General of the Ministry of Health, it has a lot of weight. And the gentleman got a lot of media coverage. He had many minutes over primetime TV news every night. And you understand that when a younger physician is in front of the camera saying, no, it is serious, pandemic, COVID is killing people, it is killing people in a manner that we have never seen, it is serious, it is dangerous, and this gentleman is there saying, this is nothing more than a flu. It took the media quite a bit of time to understand that there is no scientific evidence to what he's saying. He is giving his thoughts, but they were not presented as thoughts and ideas, and he disappeared from the media. And I took the picture of him getting the vaccine against COVID, an item that was did not get as much attention as his statements around this is nothing more than a flu. And the role of I would say conflicting paradigms or agendas on media is a very interesting one. And I think that's something that in a democratic society must have the place, but we need to think about how do we do it in a smart way? Because one of the things that we saw, and I have to say that as a healthcare professional, it was very upsetting for me, was to see people that presented their opinion in a professional forum, and most of the people in the room, disagreed with them, so their position was not accepted. So the next step for that people would be to go on the media and present their opinion, even though most of the experts said that they had a different one. And then the question of, okay, what are the boundaries between a legitimate professional discussion and bringing it to the public who does not understand the science behind it? It's a challenge. It's a challenge, and unfortunately, it was ill-used by groups, mainly the anti-vaccine groups, in the discussion about the safety of vaccines. We are all talking about internet. We have people in Israel that don't use internet. To be honest, the elderly people, my parents don't use internet. People who are ultra-religious Jews don't have internet. So we need to think about different methods for different groups. We don't have one size fit all solution, unfortunately. It's not World War II where everyone listened to the radio, hopefully, and that was the way of getting the message, or read the newspaper. And you were looking for the newspaper who has the largest number of readers. Today, we must have many different channels. Community channels are, and in Israel, they are very popular. Small communities have their own Facebook groups. They have their own channels of communication. My nephews are always telling me that we are all talking about Facebook and we are old, because Facebook is no longer the most important means of media. It's TikTok, it's Instagram. And my big question is how do we make sure that we are up to speed with new technologies, new things that are happening there? Personally, I have the feeling that in many cases we are legs, not a leg, but legs behind what is going on social media. And I think that we said goodbye to the newspapers too early, and they have a role, and we're not using newspapers as we should. Next, please.
Thanks, Hein. Just to note this to 2 minutes, please.
Yeah. At the end of the day, it's about marketing. And emergency organizations are not good in marketing. And you see here the campaign on vaccination in bars, in pubs in Tel Aviv, which is a pure marketing, very successful one. I spoke about the cultural background, and we need to think about different communities and tailor the response to their background. Again, a challenge that I'm not sure we are ready to do it. The last virtual communities is something that we are ignoring. We are thinking about communities as a geographic entity. In many cases, virtual communities are way more important. My last 2 points are that in Israel, it became the issue of vaccines mainly became an issue of civil rights and a politicized discussion, which caused a lot of harm to our business. And at the end of the day, it's about trust. We are talking about communication. Communication is important, but the question is, do people trust the communicator? If they trust us, we are successful. If they don't trust us, it's not about what we are communicating, it's about building trust. And I think that this is the great challenge. And the fact that in many cases, authorities lost trust with their constituencies during the lockdown phases and changes in policies affected a lot what we are seeing now during vaccination. My last slide, please. Just to say thank you very much, and to say that this is the word hope in Hebrew, and this year hope comes with the vaccine. So please get your vaccine whenever you can. Thank you very much.
Thank you, Chaim. I think some very, very important messages there, especially about the vaccine. I think we'll see some of your points as we go further into presentations, especially around the tools. Okay, so moving on to our next presentation, Andreas Arnold from DH Pol. Over to you, Andreas.
Thank you, Natasha. I hope you can hear me loud and clear.
Yeah, perfect.
Perfect. Yeah, good afternoon. I will present you the results of 2 studies carried out by German Police University in the context of Proactive. And a special focus will be on common communication approaches for law enforcement agencies and vulnerable citizens. For example, older people, children, people with mobility restrictions. Yeah, the 2 studies, we conducted an online study and an interview study in the field of Cbrne preparedness and response with first responders from numerous European countries. And a special focus of the study was on the area of Cbrne communication with the public and the extent to which first responders consider the special needs of vulnerable groups in Cbrne management. And in a second online study with civil society organizations representing vulnerable groups, the focus was also on specific needs of vulnerable groups in Cbrne management. And the 2 studies allowed us to identify gaps between the current Cbrne management and the specific needs of vulnerable groups. And in addition, we formulated recommendations in the 2 studies to address these gaps. Next slide, please. Yeah, adequate communication on the part of first responders can help, of course, minimize the negative consequences of a Cbrne incident. So communication is essential. And now the reality is that first responders encounter a diverse civil society in large-scale incidents. And this includes also particularly vulnerable groups with special communication needs, for example, hearing impaired persons, blind persons, etc. And we investigated whether their needs are taken into account in Cbrne management. Next slide, please. Some results. Yeah, we asked the first responders if they specifically consider vulnerable groups in their communication strategies for major emergencies. And the results showed that the needs of vulnerable groups are rarely addressed in communication strategies. Yeah, when the needs of vulnerable groups are taken into account, the needs of people with mobility restrictions, older people and children are most often considered. Next slide, please. Yeah, for people who do not understand the respective national language, it is important that Cbrne information is available in additional languages. However, in the study with Cbrne practitioners, only about half of the respondents indicated that their organization provides Cbrne information in additional languages. Next slide, please. Yeah, gaps are also apparent in the area of special language formats. Emergency response organizations, as can be seen in figure 2, relatively often use simple language and pictorial language in Cbrne information they provide to the public. But in contrast, sign language and Braille are very rarely used. And in figure 3, one can see that civil society organizations representing vulnerable groups use audio language, sign language, and Braille comparatively frequently to communicate with their represented vulnerable group. Yeah, as a result, it can be stated that certain language formats are currently still too rarely used by emergency personnel to cover the needs of certain vulnerable groups. Next slide, please. Yeah, in this context, for example, collaborations with civil society organizations would be helpful to offer Cbrne information, for example, in sign language. And in the case of children, among others, it has been shown that psychological services are still too rarely involved in Cbrne communication. And in the case of pregnant women, there's a need to get information about the consequences of a Cbrne incident on their child. In this regard, cooperations with midwives are conceivable to provide Cbrne information in the aftermath of a Cbrne incident for pregnant women. Next slide, please. The importance of cooperation with emergency organizations was shown by the question whether representatives of civil society organizations think that their cooperation with emergency organizations has been helpful in ensuring that the needs of the group they represent are taken into account. And yeah, 60% of the respondents in our survey answered yes to this question. Next slide, please. In summary, there are significant gaps between the current Cbrne management and the needs of vulnerable groups. Yeah, this can also be seen in figure 5, where less than 20% of the civil society representatives surveyed indicated that they very frequently or somewhat frequently came across Cbrne information they thought would be useful in preparing their represented vulnerable group for a Cbrne incident. Next slide, please. Yeah, as I mentioned earlier, we have developed recommendations to address these gaps. And yeah, here's an example from our study with Cbrne practitioners. Recommendation 8, communication before, during, and after Cbrne incident should support the public more effectively to prepare for and to cope with the specifics of a Cbrne incident. Next slide, please. And a recommendation from our study with civil society organizations, recommendation 15, follow-up information material should be provided that addresses the different information needs of certain vulnerable groups, for example, the information needs of pregnant women. Next slide, please. Yeah, with this example, I want to show you the structure of the recommendations in more detail. Yeah, in addition to the recommendations, we have formulated courses of action to implement the recommendations. And furthermore, we have always clearly formulated the responsible stakeholders to whom the recommendations are addressed. Yeah, one example for the courses of action, if possible, materials suitable for children that illustrate the decontamination process in a playful way should be provided. Next slide, please. Yeah, and if you're interested in the recommendations, you can find them in the reports of the 2 studies on our project page. Next slide, please. Yeah, finally, I would like to draw your attention to 2 studies that we are currently conducting On the one hand, we are conducting a study with law enforcement personnel, which is concerned with statements on 6 topic areas in the field of Cbrne, preparedness and response. Yeah, the study will take less than 10 minutes to complete. And afterwards, there will be the possibility of an interview to discuss the results in more detail. And we are also conducting an online survey with first responders. Yeah, Natasha will provide you with more information on the studies after the webinar. And yeah, we would very much appreciate your participation, and you are also welcome to share the information with interested contacts in your network. Next slide, please. Thank you very much.
Thank you very much for that, Andreas. And of course, I will be happy to share the information for the survey after the webinar. Okay, so moving on to our third presentation for this section by Peter Daly from the Health Service Executive in Ireland. Over to you, Peter.
Thank you, Natasha. The first thing you should notice is that I'm coming out under a different name, the Irish Centre for Emergency Management, because the Irish Health Service is in day 6 of a major cyber attack which has crippled our system nationally. And that's something for the future. But we've facing enormous challenges, far greater than the beginnings of COVID. But apart from that, so I'm going to speak about communication challenges when responding to a crisis event. Thanks, Natasha. Next slide. So what this is the search for extraterrestrial intelligence. And what this really says is that there's always somebody listening. If you just click on there, there was a famous statement during this World War II that loose lips might sink ships, and loose tweets also sink fleets and that kind of thing. So there's always someone listening, even though you think you're not communicating. One of our lessons that we have learned is that there's always someone out there listening. And there are 2 parts to communication. The famous George Bernard Shaw, who kind of made the point, he said, if you could click again, Natasha, he made the point that the myth is that someone has heard what you've said. And if there's something that we've learned in the last few days in particular, in a crisis such as we're in at the moment, there's no guarantee whatsoever that the person that you're trying to speak to has heard what you've said, particularly if you're shouting at them. So, and I mean by shouting at them, I don't mean literally shouting, but that can be this case. So if people are there trying to find out, has their appointment in the hospital been cancelled, and these are very vulnerable people who are undergoing very serious treatment, then you have to be very careful in how you deal with them. And when you've lost your traditional means of communication, what do you do next? So next slide, please. So so just keep clicking until the signs come up. So basically what people think, there are various kinds, but we're not in the communication side. We're not in the PR business, although we are in one way. We're trying to convince people, but for certain types of communication, especially when the news is not good, it's not PR. There's a danger that when there's too much political influence, that we change the message to suit the circumstances. And as I said on that famous show, you can sell something quite easily. Next slide, please. So just keep clicking. So basically, the strategic aim of communication strategy is something that has to be decided. My background is emergency management, originally from the military, with a strong Cbrne background. But one of the things that when in devising a response plan, there really has to be a crisis communication plan where all the detail is worked out in advance, and at least you have something to go to. And that will include trying to figure out who are you communicating with, who are your stakeholders, in the famous word. So next slide, please. So we said it's not PR. The biggest stakeholder is not the media, It's not government, it's not yourselves, it is those who are affected. So when working out a communication strategy, one of our learnings, reinforced dramatically in the past week, is to decide who precisely is going to be affected by what has happened and why do we need to communicate with them. Next slide, please. So there's a famous quote going back to Boutros Ghali as Secretary General of the United Nations in 1996. And he was talking about CNN. And basically he said that television's impact on the UN resembles the 16th member of the Security Council. And he was making an address, but it's an interesting view that occurred as long ago as 1996, where the influence of media, television at that time, and now us with social media, is so great that he could almost describe them as the 16th member of the Security Council. And equally well, we've conducted exercises in the past where we allowed fake media messages to influence the group, so that the extra person, the unseen person in your crisis management team could often be the media. And for that reason, we have banned communication, television in the actual crisis management team room. And we have put the media team into a different room, and they filter everything and bring in what's important and send out what's important. Next slide, please. So the means of communication, you have your own means of communication. And if you've lost it, what do you do? So you have internal and external communications. So, and they're quite different, and the means of talking internally and externally are quite different. We have, and we've started to use it far more frequently in the last week, an internal app by which we can communicate with our own employees and try and give them something by which they can communicate and hear the truth. But equally well, there are external communications to the outside world, and both have to be the same. You can't, one of our messages earlier on was that the internal message to our own staff and to our own people working had to be the same as the external, or else you get a conflict. You get people are confused by what they said. What appears to be two different messages. And that comes about as well by what Chaim spoke about earlier on, which is gaslighting, where people who are official spokesmen, technically proficient, knowledgeable, are being gaslighted, meaning their opinion is being rubbished by other people who represent a very small minority. It leads to confusion among those who are listening. Next slide, please. So the question is, who are the media? And basically, we have the traditional media, the radio and television, newspapers, you have press conferences, and then you have social media. And one size definitely does not fit all, because there's a different way of getting messages across to the different demographics of age, education, group, where people live within the community, if they're immigrants. Like we ended up with 38 different languages information to be sent out about COVID. And in the end of the day, we didn't invest enough in finding out precisely the kind of language that some of our immigrants have come from. Is that not everybody speaks what we as the host country think they should speak. So that was one of our learnings as well, is that in future, when we're producing a written document or some kind of communication, we have to have someone from that community, whatever country they're from, whatever demographic they're from, if they're intellectually challenged or handicapped in some way, they have to be involved in deciding how the message will go out, because that's their skill and that's their expertise. Next slide, please. So my previous job, I'm the COVID project manager at the moment, but previously to that, my job was to look after the major emergency plans in our organization. And many emergency plans omit the communication plan. And if they do, it's just a small plan. You know, it's a small part of it. There's no detail on it, and it's kind of glossed over. And I suppose that's my second takeaway, is that you must plan. Failing to plan for a communications process is the same as failing to plan for the emergency itself. It makes it worse. You exercise plans, therefore you must also exercise the communication plan. Next slide, please.
I think that's it.
Okay, so that was it. There were my recommendations for the mitigation of management of communications when dealing with crisis event in Cbrne terrorism. So all of that complication, and when you lay Cbrne on top of it, one of the things that the minute the magic word of chemical threat is mentioned, a whole series of other problems enter people's heads. That's it. Thank you.
Brilliant. Thank you very much for that, Peter. That was very insightful. I think the power of the media is very impactful, and a plan is very important. So thank you for that. Okay, we're going to move on straight on to the next section to look at different mitigation and management structures for communication. I'm going to hand over for this part to Dr. Daly Weston from Public Health England.
Hello, everybody. Yeah, so I'm Daly Weston. I'm going to talk you through a bit of work that we did as part of Proactive relating to a human factors analysis, essentially a couple of literature reviews and some evidence synthesis work to develop some recommendations around preparedness and response. These are kind of the overall objectives for the piece of work. You'll see in what I talk about a lot of similar things that are already being discussed, which is really good. We're kind of triangulating some of the key topics. The purpose of these human factors analyses were to identify the factors both from the literature, the kind of published literature, and from previous and existing projects that are associated with effective preparedness and response in Cbrne contexts, and also to understand from a review of the practitioner literature the way in which current policy and practice differs across different organizations and countries, and then to identify gaps between what we know is kind of gold standard based on the published evidence and what's currently underway in terms of current practice. Next slide, please. So to start with, the very first thing that we did was we did a systematic literature review of strategies for Cbrne preparedness, including public perceptions of these strategies. And this review focused on the published academic literature. Next slide. So it's very much a fairly typical systematic review. We searched 4 different databases to identify somewhere in the region of 5,500 citations. These were deduplicated. Members of the team went through. It was an entire kind of consortium effort, our proactive grouping together here to reach the point where in the end we had 41 academic papers that met all of our requirements for demonstrating the gold standard, the highest quality evidence regarding public perceptions and responses to Cbrne incidents and the management of said incidents. Next slide, please. What do we learn from the findings here? Well, there's a lot to dig into, but to give you just some really high level points, we know that the public's understanding of prevention and management strategies is very low. We know that effective communication, where it is delivered, is easy to understand, is disseminated in multiple ways, is delivered by a credible spokesperson, and it incorporates various psychological constructs, things like trust, provision of information, emotional responses, efficacy in the recommended behavior, and relationships between the responders, between the local communities as well. So we're seeing here some of the things that were already discussed earlier, in particular trust. I don't think it's possible to overstate the importance of trust in increasing uptake and adherence of recommended behaviors in an emergency situation. So I'd say that's a really key take-home message. Next slide, please. To complement this piece of work, so now we've identified what is the gold standard, what is the current state of play in the research literature. We also did a systematic literature review of tools, standard operating procedures, guidance and policy documents for the management of Cbrne incidents from a range of countries across the European Union and further beyond. Next slide, please. This fairly mammoth piece of work resulted in the identification of 95 different documents that were identified from 18 different countries. And we used a framework approach, which is a commonly recognized approach to identify key points, to synthesize them and to theme them together so that we can draw some really quite quite detailed, yes, but also some higher level conclusions. Next slide, please. And what we see here, just to take the really highest level points, is that across the guidance documents, there's a really heavy reliance on practical and physical aspects of management of CBRNE, but they tend to lack the recognition of the psychosocial aspects. So the kinds of aspects that relate to communications, positive factors of communications, developing trust, using trusted spokespeople, using credible spokespeople, etc., etc. And also that there's discrepancies in the information that's provided in guidance documents between countries, as you might expect, but also within countries. So there's further work that needs to be done to harmonize there. Next slide, please. And so this is just a real whistle-stop tour through all of this, and hopefully it's flagging some of the key words and key concepts and phrases that you're all familiar with and that resonate. But what we subsequently did was we took these two reviews and we took the findings from these two reviews and we looked at them next to each other. We conducted a really in-depth and intense systematic approach to synthesizing the findings to try and improve our understanding of, yes, current policy and practice, yes, current work relating to public perceptions of current mitigation and management strategies, but also the factors that might affect public willingness to comply and make some recommendations that relate to those. Next slide, please. And this process was really quite a long and varied process that involved an awful lot of input. So it involved inputs from both the two, so D1.1 and 1.2 are the two reviews that I've just presented to you. We then took those reviews and we had them reviewed by stakeholders, so practitioners, yes, but also representatives from vulnerable civil society. And we asked them, what do they think is important? What's missing from their perspective? What could be improved from their perspective? And we also, alongside this, researched relevant research findings from various related EU projects to try and identify where the commonalities and differences were. Next slide, please. And all of that brings us to, these are a very kind of small, but I would really recommend that you look at the version on the Proactive website that Grigori pointed out before of deliverable 1.3, because it goes into quite a lot of detail around various different recommendations, the what's, the when's, the for who's and the why's. And these are based on, yes, the literature that we've identified here, but also our work within our emergency response department, of which I'm part over the last decade plus, looking at communicating in crises. Looking at some of these recommendations, you can see that they're broadly focused around developing guidance. The guidance documents need to be uniform, they need to be evidence-based, they need to emphasize that the way in which practitioners manage an incident will affect the way in which members of the public behave, which is a really key point. We can see that there are some recommendations around countering low knowledge, so increasing knowledge. Information campaigns and education to build public knowledge needs to be implemented, and we're doing some work with that as part of the Proactive project. There's quite a lot of recommendations around dissemination, so how you need to provide the information, how it needs to be pitched, using multiple sources, communicating and demonstrating respect for public needs, etc. And then also communication with the public in general. We talk about the importance of these kinds of communications being respectful, these kinds of communications providing information to loved ones about, to the public around their loved ones, around efforts to apprehend any criminals, and around the importance of complying with instructions and with information. Really, what we know from this work and from a variety of work is that the best way to encourage adherence is, yes, to have the materials delivered by trusted spokespeople and to come from trusted sources, but also to really emphasize the efficacy of the behaviors that you're recommending people undertake. People need to understand what to do, they need to understand why they should do it, and they need to understand exactly how it's going to help. And if you communicate that information to people, then we have a raft of evidence that speaks to the great likelihood that people will adhere and will comply. And then just kind of a special point at the end here, because I think it speaks to a lot of what the Proactive project is trying to do. There's a real critical need to give more consideration to vulnerable populations in the development of policy and procedure for the management of incidents. And I think that's one place where our work can really come into its own. Next slide, please. And that's it, really. it's just acknowledgements and thank you. These are some of the various people from the consortium and from further beyond that helped out, but really it was a collective team effort from the whole of Proactive. I think that's it from me. Natasha.
Thank you very much for that, Dale. I think, as Dale said, more details available on the website, so please do have a look, because a lot of work went into the very short presentation that Dale's just run through. Just moving on then to the next presentation. This will be given by Barbara from the University of Innsbruck. Barbara, I'll hand the floor over to you.
Thank you. Thank you very much. I will start with the psychosocial impact of communication on the first responders and the public, and perhaps you can give me the next slide. I will immediately start with our study. These are just the measures that we took. It was about stress, about well-being, and about emotions. And just give me the next slide. We did one study on healthcare personnel on 3 time points. The first time point in time was in June, at the end of the first wave, with 1,160 participants. You can give me the next slide. The second time point was in December, in the middle of the second wave. It was with 780 participants, and we did also a third measure now in May, but we will focus now only on T1 and T2. You can give me the next slide. Here you just see the points in time that we took the questionnaires. Next slide. What we see is in all, and it's not only our findings, but also the findings worldwide, but what we see is that stress is significantly rising in healthcare personnel throughout the pandemic. The next slide shows that, you can give me the next slide. The well-being is significantly decreasing during the pandemic. Yes, next slide. What we see in these emotions, and this is what relates to what I will say about communication, is especially in T2, the powerlessness, the feeling of powerlessness is rising in the healthcare personnel, and the sorrow. You can give me the next slide. We had also qualitative data. We did focus groups and interviews, and what we saw in the first wave, it was mainly about anxiety. Healthcare personnel feared about their own protection, but especially about their protection for their relatives and friends, and they had a lot of moral distress, which means they had a lot of feeling they had to do things that are not morally, that are not according to their moral standards, like hindering people to see their dying relatives. In the second waves, there was more routine in dealing with PPE and with the patients, and with COVID itself. There was a growing exhaustion, and we saw a growing polarization between healthcare workers and the population. And stigmatization and violence grows, in the whole world, not only in Austria, against the healthcare workers. In the third wave, now we see a normalization of COVID. We see a big exhaustion. We see frustration because there's no end in sight. The mutations take away hope, and the loss of job commitment in the healthcare workers. You can give me the next slide. So what is the problem with communication that we see? And this is linked to these growing problems. One thing is the contradicting messages of the decision makers. As many of my talkers before, especially also Chaim has said, it's not only about giving information, it's about trust and dialogue. And this is missing at the moment. Especially the decision makers, they tend, especially in Austria, but I think it's not only in Austria, the one who tells the good news is the good guy, and the other one is the spoil sport. And in Austria, the chancellor is always the good guy, and the health minister is the spoil sport. So the chancellor always says the good things, and the other one has to say the bad things. And this is not a good way of communication. It's PR, like one of my speakers before said. It's not crisis communication. There's a lack of trust in decision makers and the management. There are extremely high gaps in communication, especially with the vulnerable people, depending on the language, the channels used, the role models that are missing, the myths, but especially also here about the lack of trust, the lack of trusted people, and the lack of dialogue. They don't go into a dialogue. What we see is also in our people, we don't reach younger people, for example, and in our sector, in the Red Cross, we saw that the younger people, they needed to be listened to, and they needed trusted healthcare workers that explained to them, especially about vaccination, and listened to their concerns and responded to them. Another big problem that we see is in the 100% ideology. We have the ideology that the vaccine has to be 100% protective against the illness. Everything has to be 100%. There's no acceptance of insecurity and rest risk. And there is no realistic view on how the change from pandemic to endemic situation could take place in the autumn, especially when we will not have population immunity until then. You can give me the next slide. So we see regarding polarization, we see that healthcare workers often focus on the threat condition and become more and more hopeless, powerless, and exhausted. And the population focuses only on the hope side, but tends to ignore the threats. And so the population does not understand that summer will not solve all our problems. And we see a big danger that vaccine hesitancy will grow as soon as the positive messages are given, and the positive development now during the summer is giving them the illusion that everything is finished. So just one important thing that we can do in these 10 minutes is how can we communicate threat without taking away hope? This is a very important aspect. Give me the next slide. Our general recommendations are that we have to enhance trust also in the international, European, and national healthcare institutions. We have to strengthen the data quality and accuracy. We have to stop the all or nothing communication about effects of vaccination, side effects, and so on. We just have to make use of our prevention concepts, give a long-term vision, anticipate the problems, and do not use no-risk pictures. We have to enhance self-efficacy with positive messages, like the virus dominated us, but now we start to dominate the virus. We have to skip the 100% myth, and we have to use nudging. If you ask Austrian people why they get vaccinated, there are two reasons. One is traveling, and the other is to be able to go into a restaurant or bar. You can give me the next slide. There's a very nice study by Peterson and colleagues that shows the effect of communicating only the threat or communicating the hope and the threat together. On the left side, you see the hope condition where you communicate the threat. In the red thing, line, you see what happens with the mutations, and on the right side, you see what happens when in the long term if the vaccinations are effective, and in the right side you only see the threat condition. And on the basis, you see that if you give people the hope condition, then they are less fearful, they are more hopeful, they see more public health threat, they adhere more to the guidelines, they believe that we safely can get through, and they believe that strong measures are required. You can give me the next slide. So what are the conclusions? The conclusions is that we have to try to stop all or nothing communication, the 100% myths and the no risk visions, and a double communication strategy is very important that uses visual measures in order to show both threat and hope, and to use a long-term perspective, and not only this 2 to 3 weeks perspective that we have used or that has been used until now very often. And we try to, I'm in the advisory board for the health ministry, for example, and we try to coach and to advise decision makers in how they communicate to the public. Thank you very much. I think this was my last slide.
It was. Thank you very much for that, Barbara. It's very interesting to see the correlation between the hope and the threat in terms of communication. Just as with the previous sections before us, you're welcome to, there's some conversations in the chat at present, you're welcome to ask questions in the chat. Alternatively, we can obviously answer questions after the webinar if there's still further conversations to be had. I'll just go ahead and share my video. So the next session is around the recommendation on the types of tools available for supporting interagency and public-facing communication when dealing with a crisis event. Unfortunately, you will have to listen to me for just a bit longer as I will be presenting the next few slides. Okay, so I'm going to go through a quick introduction of the Proactive app. This ties in from Grigore's initial introduction. In one of the outcomes of the Proactive project is to develop a toolkit which consists of a web-based platform and 2 mobile applications to be used by first responders as well as civil society, including those more vulnerable. The app itself is in the very initial stages of development, so we have a first version, and we are now contacting our network partners in the CSAB and PSAB groups previously mentioned to attain further feedback so that we can develop the app specifically addressing accessibility for vulnerable groups. So the research done prior to now as part of the project, which previous presentations ran through briefly. Here you've got a very high level summary of some of the information that came out of the research that we can address or at least use as part of the design and the development for the app. So information formats, and by formats I mean things like multiple language and translation options, verbal and non-verbal communication, the use of videos, any visual content, but also written text. Another section of this is the structure of the information itself, so how we actually present the messages and the communication, interagency and to the public. And we found that this needs to be honest, it needs to be empathic, it needs to be assertive and reliable, it needs to be very much instruction-based and evidence-based, but most importantly, and I think this links to the trust elements that have been in 2 previous presentations today, it has to be from a credible source. In terms of the actual stakeholders that we want to address as part of the project, there were 2 key elements, and one operational, so the idea of interagency cooperation and the information that they want to share or communicate is different strategies. Sorry, please can I just ask everyone to mute themselves that aren't speaking, thank you. Different communication strategies, in particular guidance documents for vulnerable citizens, all forms of disaster communication and protocols between first responders and civil society organisations that could be involved in an incident. The other aspect was the public-facing communication that we would like to show with the toolkit, and that really revolved around disaster communication in general, but specifically focusing on containment procedures, evacuation procedures, decontamination, health-specific and risk communication. And what we found is that the public would like to know more information prior to an attack. So it's getting a balance of how much information to share. But essentially the public said if they were going in prepared for an incident, if they should find themselves in that situation, then they feel like they would be able to address or deal with the situation better. So just to show you the initial design of the app, on the left-hand side there, you've got the home page, and from the home page, you can find out a little bit more about the purpose of the app, related incidents or new incidents that are within your area, live news feeds, so links to different websites and news feeds, again, local to your area. You can also get involved through contacting your local LEAs and relevant organisations. And one of the key points was there will be additional Cbrne information available directly in the app. To use the app, you could do it without registering, however, some of the functionality won't be available unless you register. So one of the concepts we're supporting is two-way communication, and we've done this through interfacing directly with relevant live news feeds, specifically around news channels, Cbrne information, and again, these would be local to your area, your country, etc. We really wanted to promote the concept of the ability to for the public to have a way of contacting first responders or certain LEA organisations, but also for LEA organisations to provide messages directly to the public as well. Also access to different apps. We're aware that a lot of countries, and I think Peter did briefly mention one that they're using in Ireland, already have apps for communication. They're starting to understand agency internally and externally. Hopefully you can still hear me. I think my internet's cutting out again, so I'll just turn my video off temporarily.
Yes, you're back, Natasha. We can hear you.
Brilliant, thank you. So one of the key concepts of the portal itself is the ability to provide an innovative response tool. So the app itself, if you are a registered user, you can actually share information about an incident that you are either involved in or a bystander to. And you can share this information via text or via sending a video or images or even an audio file. This information is then sent directly to the LEA that's involved in that area, that's responsible for that area. They may receive one report, they may receive several, they may receive hundreds of reports. The information that they receive is not at this point public information. It's very internal to the LEA organisation. So they can review the information receiving, they can verify it using their existing processes, procedures, communication methods that they've got. They can send people out on site, etc. Once they've verified the information, they can then choose to create an incident with an update, and it can have images or video or audio files, basically giving the message to or communicating the message about the incident to the public. And we'd specifically like to address vulnerable citizens in this situation. And that is why we would choose different ways of providing that information, for example, videos or subtitles, etc. Once a registered user has registered, they can receive live notifications as well via their device. So every time the law enforcement agency send out an update, they will receive a notification directly to their device with an update. Final concept, or one of the concepts of the portal itself, which I previously mentioned, is the concept of sharing information prior to an event or during an event to enable the public, but also different agencies to be prepared in the case of an event. The example I've got on the left here is one of the documents that we've put together as part of the project, specifically Public Health England, and you'll just see that it incorporates some of the formats that we've previously discussed. So it has the concept of pictograms, and it has very clear and concise text. So that's the sort of information that we would like to share. And again, it was really to give the public and interagencies a chance to be more prepared in the case of an incident. One of the key functionalities of the Proactive platform, so to speak, the toolkit, is that the concept of accessibility. And by that, I mean making it or increasing the ability for it to reach a mass audience or a largest audience as possible, and not necessarily just vulnerable citizens. From a work ahead today, we learned that anyone could be vulnerable in the face of an incident, even first responders themselves, if the event's been quite traumatic. So some of the information that we were feeding back here is that it's less text, more visual, simple, it's clear. There's different formats, for example, audio and sound, bigger buttons. For those using PPE, using an app is sometimes not an option. So the bigger the buttons and the easier it is to use, it's more beneficial. As I said previously, we are still gathering feedback and we do welcome. So if anybody on the conference today does want to have a go with the Proactive app, the link is just there. And Laura, perhaps you could possibly put the link in the chat function just in case anybody does want to have a go, but you're more than welcome to contact myself after the webinar, and I'm happy to provide any further information. So just moving on to our final presentation, I'm going to hand the floor over to Eric, who I believe will be presenting on behalf of Streamwide.
Yes, thank you for giving me the floor, and thank you for No Fear to invite me for this very interesting webinar. My presentation will be a little bit different from the others because from my point of view, I will present how to share information with efficiency and security between professionals before spreading out information to public. So next, please. So our company, Streamwide, has put in place a software which is called Team on Mission. Team on Mission is a real-time and flexible, secure mission-critical communication. So many of you know that it's a mission-critical, which can exchange MC data, MC video, geolog, which maximize the value of any networks existing on the field. Next, please. So as you probably know that many professionals still in the world, around the world, are using PMR for exchanging information, for conducting operations. And now more and more they are using smartphone. But now smartphone is going to 4G and LTE broadband for having better possibilities and potential exchange of information. Why using 4G on LTE? Mainly because it's a flexible, large bandwidth. It has standards-based capability. It's very explicit access management, and you have also quality of services, mainly. Next, please. So how it looks like in the real world? In the context of public safety, the professional can enrich the voice media with video, allowing a first responder to share real condition of the surroundings area with other PSA group members. So in this way, they can exchange video, documents, and so on. So you can see on the slides, you have a private LTE. You can collect information from drones, like video, for instance. You can exchange via satellite if the communication is not good on the Earth. You have public networks. You can use public network, and naturally you have a head office from which you can redispatch all the information you received. And this information, the spreading of information, can also to be spread out to public. Next, please. So, as you know, for health organization, reliable communication solution during crisis is a key element for having a very good solution on the field. Next, please. So what the product capability offer to professional? You have all on the slide. So as I told you, you can exchange text, voice, messaging. You can exchange file sharing, live video streaming. You can also using call out to PBX. I don't want to be too more technical. I will say a word afterward also on secure communication. It's totally different to, for example, WhatsApp or Snapchat or others, because it's a tailored system, which means that not everybody can enter the system. Only people previously registered can use the system. So we are also interoperable with PMR, so which means that any professional using PMR radio system can communicate within Team on Mission. Also, professional can put in place mission process management, which means that fire brigades, police can have their own process inside the system. And naturally, we can also be connected with public internet resources. Next, please. So push-to-talk is functioning with predefined ad hoc group, which means that we have to be prepared before a crisis for having a better response team, for contagious disease specialists inside the system, for instance, police. That means that with our system, professionals can exchange between different agencies. That means that police can talk to fire brigade can talk to medical supplies, hospital, and so on. Naturally, this exchange, this telecommunication exchange, is possible within Wi-Fi, which is internet, 3G, 4G, 5G, even private LTE when in countries where private LTE is authorized. not in all countries. Next, please. So as I told you, it's a tailored system, which means that there is a dispatcher, somebody which is the dispatcher responsible for the system, and who has control and with the teams on the field. So the dispatcher can localize users or teams on the field. It can exchange naturally voice, images, and so on. You can also have localize the teams exactly where they are, and to set up a group of discussion, a group of talk. It could be a multi-talk group, because with the dispatcher you can have different talk groups at the same time. And also the customer, the dispatcher, so we can customize the icons on the map. Next, please. Also, our system can be installed inside ambulances, which means that the communication can continue on the field. So we can equip the ambulances with team and mission. Could be ambulances, could be first responders, and so on. So which allows better coordination with the dispatcher, higher responsiveness, and access to multimedia features. And actually, in the same way, inside the ambulances, you can use Wi-Fi or other connection. Next, please. So how it looks like, you have to press several times to have the appearance of the new images. Thank you. Again. Okay, and okay. Once again, well, thank you. So you see at the central of the slide, you have the laptop, you have the console of the dispatcher, you have the smartphone on the left, and on the right you have all the connect teams globally. You have the contacts, you have the secure instant messaging, you have the VoIP, the normal calls, you have the push to talk, like a radio system, you have the video, you have the geolock, okay, you have the My Business, which is all the digital forms for dedicated specific operations or management. And things very important on the left of the slide, you have encrypted communication, which means that it's very difficult to enter the system. Only, you need to get secure codes before entering the system, a double secure codes. And which means that when you reach somebody within the system, you exactly know who is the person, why the person is inside, and what are the responsibility of the person you are talking to. Next, please. Okay. And after or during also a mission, medical staff can initiate a live video with other colleagues from inside the same hospital or outside different places. It could be naturally inside one country, but it could be also within different countries. But once again, this communication, video communication with these collaborative tools is something totally encrypted. Next, please. So that's a security standard. I don't want to go too much in deeper on these points, but if you have some question, I can answer this question, but it's more technical. But the things to keep in mind is that Team on Mission is a business application which is totally encrypted with several protocols which guarantee at the maximum the confidentiality of the information, and also the sovereignty of information, which is very, very important. Next, please. To give you a broader idea on what we are doing at the moment. We are belonging to a consortium, which is called Broadway Consortium, which is leading by Airbus company. And the purpose of Broadway is to allow all responders within Europe to communicate seamlessly each other without technology boundaries. What does it mean? It means that with a simple smartphone, encrypted smartphone, fire brigade in France, for instance, could access police officers in England or in Germany and exchange information, exchange video, and having a real view on the situation on the field. Now we are on phase 2 of this project. We have just delivered 2 days ago the phase 2 to the group of buyers. And normally in phase 3, we will be able to set up the pilot system for opening market afterward. So next, please. Sorry, if you can come back again. When you will receive the slides, you have a web link at the bottom, and on the web link, you will have a presentation of a Broadway project. Next, please. So that's our company. So just to inform you that we have around 130 customers worldwide, which represent 100 million end users worldwide. We are present on 5 continents, and our system is operational. Just to give you an example, French police, SWAT police is using our system for the SWAT operation. Next, please. Okay, so you have all our presence within the world from west to east. Okay, so thank you very much to all. And if you have any question, probably when you receive the slides, I will be very happy to answer you and to give you more details if you need so.
Thank you very much for that, Eric. That was really interesting. It will be interesting to see further how it progresses in phase 3. So please do keep us updated on that.
Yeah, we hope to be in the phase 3.
You will.
I think we have a good chance. Okay.
Good, good. Good luck then in that case.